Hello, everyone. It's February the 19th, Friday. Again, regretfully, but at the same time, optimistically, I have to report to you we've lost 23 additional West Virginians. It's hard to believe we're saying that that's optimistic or optimism. You know, it's tragic beyond belief. We all get that. We all know that. But where we've been 1,000 times, we've got to absolutely keep these families in your thoughts and your prayers, and absolutely all of their loved ones in each and every way. You know, this tragedy of losing a loved one to this dreaded killer is just plain awful. And when it really boils right down to it, a lot of times we get all wrapped up in what's going on here or there in our lives and everything, and we don't really just get the real realization that how these families really feel and how all their loved ones really are suffering. And so please just remember them. The 2,226th death in West Virginia is a 72-year-old female from Lewis County. The 2,227th death is an 81-year-old female from Upshur County. The 2,228th death is a 91-year-old female from Wood County. The 2,229th death is a 68-year-old male from Kanawha County. Now get this. The 2,230th death in West Virginia is a 101-year-old female from Harrison County. God bless all of them, but a special God bless to this wonderful lady. Our 2,231st death is an 84-year-old female from Wood County. Our 2,232nd death is a 67-year-old female from Taylor County. Our 2,233rd death, let me back up. Our 2,232nd death is a 67-year-old female from Taylor County. Our 2,233rd death is a 93-year-old male from Webster County. Our 2,234th death is an 87-year-old female from Wood County. Our 2,235th death is a 70-year-old male from Harrison County. Our 2,236th death is an 83-year-old female from Berkeley. Our 38th death is an 89-year-old female from Mercer County. Our 2,239th death is a 76-year-old male from Kanawha County. Our 2,240th death is a 92-year-old male from Fayette County. Our 2,241st death is an 87-year-old male from Jackson County. Our 2,242nd death is an 85-year-old male from Berkeley County. Our 2,243rd death is a 63-year-old male from Wood County. Our 2,244th death is an 88-year-old male from Wayne County. Our 2,245th death is a 91-year-old female from Mercer County. Our 2,246th death is a 92-year-old female from Mercer County. Our 2,247th death is an 87-year-old male from Jackson County. And our 2,248th death in West Virginia, a 54-year-old female from Marion County. Don't forget them. Don't forget them. The majority of these people are elderly people, and I say over and over about losing our wisdom. A couple of them are 51 and 54 years old, tragically young, tragically old. We'll miss them. God bless each and every one of them. In the first 6 weeks of 2021, we have seen now, get this, in the first 6 weeks of this year, in the last 6 weeks, we have seen a 72% reduction in the deaths from week 1 to week 6. We now have 295 positive cases that we've recorded in the last 24 hours. Our daily positivity rate's 3.12. Our cumulative rate continues to come down at 5.52. This is a wonderful number, but it can be a whole lot better, I know, but boy, what a great, great, great number this is. For the first time since November the 15th, we are less than 10,000 active cases in West Virginia. We have 9,624 active cases in West Virginia, and they have gone down now 34 straight days. Our recovered cases are 117,183. Please look at your graph, the top graph. The dark line is our active cases. The dark line, the light blue line is our recovered cases. The wider they get, the better. It's just absolutely getting better. We have 293 people that are hospitalized in West Virginia. This is the first time we've been under 300 since November the 10th. We have 68 people now in our ICU units, and we have no red counties in our state. Please pull up our map. Our map is getting prettier and prettier and prettier. Look at the green all across this map. It's absolutely doing better. I want to remind all those again over 65 that if you're 65 and older, absolutely, and you get that headache or tiredness or sniffle or anxiety, go get a test. I mean, for crying out loud, just go get tested. If by chance you would come back positive, we can give you the antibodies and make this go away absolutely with some real level of certainty. We got to get you tested. Now, I promised you on Wednesday that we were looking at lowering restrictions and everything on our businesses and our schools, and let me just take time to tell you that I think we can do this now. We want to be proactive in this, as we've been this way all along, and we're just going to keep doing exactly what we've done all along. Be cautious, be absolutely cautious, be smart, and absolutely don't panic, and do all the things that we've said all along. If I could just read that to you just 1 second, this we said in the very, very beginning. It's not a time to panic. It's a time to be cautious. It's not a time to be fearful. It's a time to be smart. It's not a time to be weak. It's a time to be West Virginia strong. That's what we've done all the way through this whole thing. So, they're much better, than they've been in the last few months. We're still a long ways from being out of the woods. We've still absolutely got to be cautious, wear our mask, and just use good common sense. We have to reinstate restrictions. If we see that we've got another surge that comes, we will reinstate additional restrictions back if, in fact, we get in a situation where we have another surge. Also, our indoor face covering requirement is still going to be in effect. So that means if you go in a public building, you got to wear a mask. Okay, now, from our restaurants and our bars, today I am signing an executive order to increase the capacity limit for all restaurants and bars to 75% of their seating capacity. That's up from 50%, and that is only that way if social distancing can be maintained between groups as they arrive and sit together. Bars may only increase capacity to the extent that they have physical seating for every patron. No standing room for people to congregate will be allowed. Hopefully, we can remove every single one of these limitations in the next couple of weeks. Now, let me just talk to you just 1 second about that. My leadership team has come to me over and over with lots of different numbers and lots of stuff. I've opted out today to move this from 50 to 75%, basically. in hopes that, from our restaurants and our bars, that'll help them. It'll help them, and it'll take just a little bit more of the burden off their back. And what I would tell you just this, from the standpoint of our restaurants and our bars and whatever it may be, I truly believe in the next very few weeks we'll be able to move that to 100%. Our small businesses, I am raising the capacity limitation on small businesses and retail stores from 2 people per 1,000 square feet to 4 people per 1,000 square feet, and from 3 people per 1,000 square feet in grocery stores to 6 people per 1,000 square feet in the grocery stores. So basically, I am doubling the limitation in our retail and our grocery stores. And again, we know that there's a very low risk of spread with these type businesses, as long as we continue to wear our face mask. Now, from the standpoint of social gathering, we were at 100. We lowered it to 25. We're now raising it back to 75. Public gatherings means any gathering of people for purely social purposes. You must continue to social distance, wear face coverings, and follow all the applicable guidelines, please. As far as our schools, next week, all teachers and school service personnel over the age of 50 that have requested a vaccine will be complete with their second dose. Therefore, I am calling on the State Board of Education to make it mandatory that all counties send their students in grades K through 8 back to full time. I am also signing an executive order to clarify that K through 8 students in all counties statewide should be in school. From the standpoint of live music, I am declaring the existing prohibition on live indoor music performances. I am clarifying that the existing prohibition on live indoor music performances, except for those incorporating vocals or using wind instruments, may take place indoors now, so long as the event is held in accordance with all the guidelines and all the documents that we have. As far as winter sports, I have been working with the WVSSAC. I have asked them to work with all county school boards to ensure they have occupancy rules or attendance guidelines limitations that will meet the social distancing requirements and other guidelines. I'm going to read that one more time, because this is for people that are going to come to the games, the sports, the winter sports. I have asked the SSAC to work with the county school boards and the county school superintendents to ensure that the occupancy rules and or attendance limitations will be met in association with all the social distancing requirements and guidelines. All businesses must continue to follow all the other safety guidelines. These include mandatory face coverings and social distancing, and all guidance documents are posted on our website. I hope that clarifies a lot of stuff. I hope that gets a lot of stuff, off our backs. And what we want to do is adjust, be fluid, pivot, all the different things that I've told you over and over and over. And our great medical, National Guard, education folks and everything, all of us feel that this is the way to move today, and this is safe, and this is what we can do today. The bottom line, everybody knows, we have to, just to tell it like it is, we had to learn to live with this. And we have to be as safe as we can possibly be, but we've got to go on, don't we? And that's what we're trying to do. As far as our vaccine distribution update, it's tremendous. We're already at 97.4% administration rate as far as the first round doses, and 94.4%, on our second round doses for the week. And our goal is to get to 100%. We'll get there. It is just amazing, the great work that's been done there. We've now got shots in arms of 413,249 West Virginians, and we have got a total of second round shots in arms of 154,798 West Virginians. We continue to lead the nation in every way. We've put in arms in the last 24 hours 7,410 doses. All we need is just more doses. That's the simple answer to this, but we're getting more. We're just not getting more as fast as what we'd like, but we're still grateful for what we're getting, that's for sure. I still want to motivate counties to pre-register and all of our people, and from the standpoint of those 65 years of age and older, the counties, we have 5 counties. There's Gilmer, Wyoming, Mingo, Mason, and McDowell counties. We need to have more of those people participate in our pre-registration. Please do that. We now have 269,000 West Virginians that are pre-registered. If you're having trouble doing it, absolutely, just call us and we'll walk you through it. It takes about 10 minutes to pre-register, and really and truly it helps us, and it'll help you like crazy to get your vaccine and us be able to notify you and everything else. Keep in mind too, West Virginia, again, first in the nation to put this in. You got everybody all stumbling all over themselves and everything. Just pick up, if you want some interesting reading, pick up and try to find out what Ohio's doing, or Pennsylvania's doing, or Virginia's doing, and you'll find people stumbling around like they're in the dark. I mean, West Virginia's done it, and I am very, very proud of that. As far as our Save Our Wisdom clinics, we're in all 55 counties. Got to watch about the weather updates and all that, and let me see if, of course, we don't have enough doses to do it all at one time. We all know that. We've been through that 5,000 times. The most pressing or most impressive number that I see over and over is now, because we pivoted. We pivoted at the right moment. We've got 141,186 West Virginians of age 65 and older. We have got shots in their arms. We've got 69,709 of them with the second round shots. Now, what does that mean? Really and truly, we've got 141,000 out of 350,000 total people, for all practical purposes, in our state with a shot in their arm. Now, those are the people we know are dying and have been dying like flies all across this country, and it's a crying shame. With those people having shots in their arms right now, not only are we saving their lives, but we're breaking the chain to save many, many, many other lives. We have an issue with our seniors over 65, and that is this: a participation rate of 75% sounds good, doesn't it? But that means we still are going to have a great many of our seniors that we did not get a shot in their arm. Could be in the neighborhood of 60,000 or 70,000. It's a pile of people. Go get your absolutely register and get your vaccine. Jiminy Christmas. I mean, how can you possibly listen to some taboo out there about growing antlers or whatever it may be? Just think about it. Where have you heard of people having all kinds of adverse reaction to getting a vaccine? There's very, very, very little of it. And the percentage chance of you being able to get this thing, and if you get it, you're in trouble. Get the vaccine. Please get the vaccine. Not only are you in trouble, but just think, and I don't want to be morbid in all this thought, but I just need you to know. Can you imagine, and it's happened thousands of times. It's happened across this country hundreds of thousands of times. We are within a gnat's butt right now of being at 500,000. 500,000 people have died. You realize how they died? They couldn't breathe. They were gasping for breath. Their loved ones couldn't be around them as they gasped for breath because of the COVID restrictions. You got to get vaccinated. Please get vaccinated. Okay, the COVID vaccine info hotline, you know, all that's up there and everything. You know, vaccine reminders, you can't get COVID from taking the vaccine. Just kind of encourage and help one another. And if you have somebody that's a little afraid or, you know, a little skeptical and everything, talk to them, urge them to get their vaccination. They really need to do that. Our testing, our free testing's all up there, your free, you know, your map and everything. And again, we thank the drive-through folks, you know, at Walgreens and Frith for all they've done. They've done great stuff. As far as our long-term care facilities, this number is amazing, beyond belief. It just tickles me to death. We only have 21 outbreaks now in our long-term care facilities. That's wonderful. We still have one active outbreak in our church community. That's in Fayette County. We want to get that cleaned up, and we want to continue in our church community to continue to just pull the rope like you've done. I mean, my gosh, what an amazing job. What an amazing, amazing job. So keep it up. Keep that pew in between you, and absolutely, if you can hold up just a little bit longer, really and truly, on getting your church services, you know, from going to church to getting your church services, you know, virtually or whatever like that. Just hang on with me just a little bit longer, especially if you're over 65. And we're going to get there, and it's going to be really good, really good. At corrections, we're down to 21 inmates and 11 staff cases. That's great, too. Corrections has done an incredible job. You know, I ask you just to remember all those that we lost, especially a great lieutenant we just lost recently. And we have 12 of the 21 inmate cases are at North Central Jail, and we have no other facility in the state with more than 2 active inmate cases. I tell you over and over to wear your face covering and everything. It's not much to ask, is it? It's really not much to ask. I ask you to give blood, to absolutely take the time to give blood. How does it mean? What does it mean? How much does it cost? Really, at the end of the day, you know, to give up maybe a little over an hour of your time, give blood. How much is a life worth? And it's worth so much. Really, really consider giving blood. We need it. We need it really badly. Okay, I've known about this announcement. We've held it back and everything from the standpoint of the, you know, to the wishes of the Toyota people. But now just get this. This is a great, great steward of West Virginia, and they have done phenomenal work. But today, Toyota Motor Manufacturing of West Virginia announced that they are, that due to increased customer demand, they are investing $210 million in upgrades into Buffalo plant, and that will result in an additional 100 new jobs at that location. I congratulate Toyota, and I thank them beyond belief. They've been with us for 20 years. You know, they've employed hundreds and hundreds and hundreds of great West Virginians. They've invested hundreds of millions of dollars, and they continue to grow their business in this wonderful, wonderful mountain state. All that's terrific stuff. I tell these people over and over, the great things about West Virginia are many, but one for absolute certain is this. We know how to love, but we know how to appreciate, and we don't forget. We should never forget what these great people have provided for the state of West Virginia. So I thank them in every way. I was on the call with their leadership the other day, and people from Japan and wherever, I was talking to different people. But what an incredible, incredible work that they've done. And if you've never been there, and you can, you know, actually maybe drop in, you know, at some point in time in the future when COVID leaves us and everything, and maybe somebody could get you, in contact with somebody that could actually take you into the plant and just watch. You could eat on the floor. It is absolutely amazing. Amazing what these people do. And the number of vehicles that they put out and the number of transmissions and engines is off the chart. So thank you, thank you, thank you. Last thing I have, this is last but surely not least, that Dr. Amjad's on the call, on the briefing all the time and everything, but her little dog Sammy just had a surgery at Virginia Tech, and she's bringing him home this morning. And for myself and baby dog, we're so happy that Sammy's doing good. So that's great. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and the governor has shared what is really good news and a reflection of the great work of all West Virginians. We know that based on the governor's priority for all of us, which was to save lives and to make sure that we maintain capacity and function of our healthcare sector in our communities, that we entered upon a priority scheme that focused on hospital workers and nursing home residents and other essential workers, and quickly also turned to our most vulnerable, and the governor created the Save Our Wisdom campaign. And as the governor said, because of that great work and because of the commitment of all of you, West Virginia, to still be very cautious and wear your mask and stay physically distanced and stay home if you can, and make sure that you're cognizant of the environments that you're in, that West Virginia has done really well. And as the governor said, we have seen a tremendous reduction in the number of deaths every week over the last 6 weeks. We see reductions in hospitalizations, reductions in ICU patients, reductions of folks on ventilators. And all in all, West Virginia is really done great through this part of the pandemic. And I think from a medical standpoint, the governor talks to all of us constantly, and we do believe, as the governor has done, that starting to have things get back a little bit more towards normal for many people is important, because we want to make sure, as this dynamic event that is COVID-19 continues to unfold, that we are constantly focusing on how we can serve the citizens of West Virginia in the best way. I do, though, want to make sure that we are also being very honest and transparent in telling people that while we are doing much better, and that is wonderful, and again, thank you to all of the great work of the folks in West Virginia, the hardworking people in the National Guard, the DHHR, the local health departments, our hospital systems, healthcare workers, pharmacies, many, many, many people, that this pandemic is not over yet. And as we go forward, we will continue to respond as we learn more. For instance, we see information coming from Israel that suggests that a single shot of the Pfizer vaccine has an 85% benefit in reducing severe disease 15 to 30 days after the immunization. So as the governor said, getting even a single dose of vaccine in the arms of our most vulnerable citizens population is really, really important. And that makes it even more vital that each person in West Virginia, and particularly our folks over 65 years old, and our folks with other medical conditions, or any of our citizens, really will benefit by signing up in our state registration system, so that when it becomes your turn to be vaccinated, that we can do that efficiently and effectively, because we absolutely know that by doing this, we're saving lives. And we want to save your life, and we want to save the lives of people that you love. But the only way that can happen is that you continue to be quite committed to doing the things that reduces transmission, and that you put your name into our registration system so that we can get a vaccine to you as quickly as that becomes available. Thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the governor pointed out, we continue to make strong progress with our vaccine distribution program. Our testing program continues to move along, one of the top in the country. Related to vaccines this week, it has been clearly a challenging week for us with the weather, both nationally and in the state. We do have some number of second doses that will not arrive this week from Operation Warp Speed, so we'll be managing that. We're working with our local partners and managing clinic changes that will occur. Some clinics that would occur today and tomorrow will be pushed off until Sunday and Monday. So we will close this week out on Wednesday with our numbers as opposed to on Sunday. But the movement is still strong and still going well, and we're doing it as the governor's tasked us to do safely and in a safe manner, continuing to move forward. We will see this week also that the doses under the federal pharmacy program to Walgreens will not arrive in the state of West Virginia for this week. They will be pushed to next week, so we'll probably receive double the number of doses. The other thing that we are making progress on is working with our two federally qualified health clinic systems, Shenandoah and Valley, that will hopefully starting next week will be receiving doses, which will be additive to our numbers as well. And we are going to continue to work closely with the Veterans Administration over the next week to see how we can maximize doses for our veterans. I just want to highlight, Governor pointed out, as did Dr. Marsh, great numbers and great movement forward. And again, as they have done, caution that we continue to follow those things, masking and distancing that the governor's laid out to us, that we've been able to reduce restrictions on. But the last thing too is there are a lot of great people behind these numbers, from the local health departments to the National Guard to DHHR to our hospital workers and our medical providers. A lot of people doing a lot of great work. And behind that are their families. So I would ask us, when we have the opportunity going forward, to pay attention to the families of these frontline folks, this small group of West Virginians who have taken care of the broader group of us in West Virginia, and try to do something good for their families. Thank you.
All right, thank you, sir. Secretary Bill Crouch with the West Virginia DHHR and Dr. Ayn Amjad, our state health officer, are both joining us today and are available for questions. We'll now go to questions from members of the media. The first from Mark Curtis with Nexstar Media.
Good morning, Governor and staff and cabinet members, and congratulations on the continuing good numbers. I don't mean to be the voice of negativity here, but there have been other states that have expanded their reopenings and so forth, and these states have also had the variants of COVID arrive. I don't believe we've had any of the variants discovered here yet in West Virginia, but are you concerned, in particular, Dr. Marsh, that we might be opening ourselves up for risk of having another surge or spike, especially if any of these variants gets into West Virginia?
Clay, before you say anything, let me just say this. Mark, we're always concerned, and I truly believe we've got to go on, and I'm going to listen to the experts, and I'm going to absolutely make decisions based on recommendations of the experts, and then I'm going to add my 2 cents and whatever I think is very, very the very best for all of us. But without any question, Mark, we would all be really foolish if we didn't think that there is absolutely always in this a possibility that things could slip back. And if they slip back, we just adjust. That's all there is to it. But we've got to absolutely go forward. But anyway, I'm sorry, Dr. Marsh, you please go.
Thank you, Governor. And I think that you touched on it really well. Mark, the governor has been really clear and incredibly consistent to say our number one priority is to save lives. So we are going to follow very closely the assessment of whether any of the positive tests do represent the variants. And the variants that we're talking about here are really the three variants that have gotten a lot of notoriety from the press, which is the variant from the United Kingdom, the variant from South Africa, and the variant from Brazil. We have not detected any of those 3 variants in West Virginia. What's really, really important, though, to note, and is somewhat reassuring, is the fact that Israel, which we're watching closely because they are testing some different ways to vaccinate their population, and they're using Pfizer mostly for their vaccination right now, that they have the predominant form of the virus there being the United Kingdom variant, and the vaccine is working very well. And as I said, recent data from Israel suggests that even a single dose of the Pfizer vaccine has a substantial 85% protection against severe complications of COVID-19 15 to 30 days after the vaccination. And also we know that mask and physical distancing, which is what the governor talked about, I talked about, General Hoyer talked about, is also very, very effective in reducing the transmission of variant forms of the virus. And that's the reason why we were very committed to making sure that we get as many vaccinations in the arms of our most vulnerable people, but also that we really implore each West Virginian to be very, very diligent about wearing your mask and staying physically distanced and doing those things that you know protect yourself and others.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, first of all, I was wondering if you could go through each one of these new changes and say when they go into effect. When can restaurants expand their capacity? When are we trying to get the K through 12 kids back in classrooms full time? And then second, I think it was 2, maybe 3 weeks ago, I asked, you all, if these were the types of things we were considering, particularly restaurants and crowd gathering size. And you said that, at that point, we weren't thinking about them. So I was hoping you could detail kind of how, your evolution of thought on this has kind of changed. What metrics did we look at? I know the numbers have gotten better, but what exactly did we point to say now is the time? Thank you.
Well, Charles, let me try to answer the back end first, because you're asking really what's going on in my head and everything. I'm watching these numbers. All of us are watching these numbers like a hawk all the time. I mean, night and day. I mean, a gazillion prayers and just really, really watching the numbers. We want our restaurants, our bars, we want us to be as close to back to normal as we can possibly be, but we absolutely know that we've lost a lot of folks. And we watch and we watch. As we've seen over the weeks, and in the beginning, whether it be 2 or 3 weeks ago, we started seeing that our death toll was starting to go down, down, down. And we saw at that point in time that our active cases were really moving down. And there has to be a point in time where you reach that point in time where you say, okay, we've gone out and looked several different times, and now we feel like that the numbers are leading us to where it's safe and it's okay to make a move. And so that's why I said on Wednesday that we were really seriously considering doing what we did. And then today we moved. Now, from the standpoint of when, I think that probably what we are planning for is in the executive orders and everything, it'll be midnight tonight. And so from midnight tonight on, we move forward on our bars and our restaurants and our social gatherings and that stuff. As far as going back to school and everything, that's going to be a decision that really falls with the State Board of Education. All I can really do is recommend. And it is absolutely my belief that we should be in school full time, period. That's all there is to it. With the caveat of trying to do it in a way that is absolutely smart and healthy and safe and with all the safety that we can bring in. From the standpoint of our kids that are 9 through 12, we all know that they can transmit this thing all the science tells us they can transmit this thing, significantly different and significantly better than our younger kids. From the standpoint of our younger kids now, all the data shows, especially with all the teachers 50 and above getting their second shots, all the data shows go to school. That's all there is to it. We need to be back in school. We are absolutely killing ourselves and killing our kids to not be in school. It is a crying shame, the void that's happening within all kinds of things, from our special needs kids and to all the stuff from the standpoint of, and God forbid, but kids are getting abused and troubled and having all kinds of issues, plus they're failing core classes and everything. Without any question, we got to be in school. We just have to be in school. And so I hope that answers it, Charles, but the Board of Education is going to have to make that call.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Last week, it was mentioned that some essential workers would be expanded in the 50 and older group to be put in line for vaccine prioritization. I haven't heard anything about that today, and I was wondering if that's been pushed off for later, and if it has, when you think that the expansion for other 50 and over essential workers might take place. And also, what is the target date for getting all 55 counties into the Everbridge system? I know the first couple of weeks ago it was 13 counties. This week, 32 counties. Hope to get 55 next week, but that looks like that may not happen. So can you break that down for me? And when will we basically be working from one single list instead of having all of the local counties which have their own lists operating, and that's causing confusion, and there's some irregularities in how these shots are being administered because they're using different criteria. Thank you.
General, this has got to be you all the way across it. Thank you, Kenny.
Yes, sir, Governor. So, Kenny, we should start, and some essential workers over 50 have already started, to include our teachers. Those will continue to roll out over the next couple of weeks as more vaccines are available. This week, 32 counties used lists from the Everbridge, the state registration system. And we will continue to see that grow. I think maybe because of the weather issues and the changes that occurred, not next week, but I think in the next 2 weeks, we'll see all 55 counties using those lists. Understand that essential workers over the age of 50, that they are important to our initiative, and we will continue to try to get to them as quickly as we can with the doses available. And again, remember, we have to pull a certain number of doses off the top each week to get to the people that go into the nursing homes that we haven't had before, staff, hospital staff, and others. So a lot of work continues to be done.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I want to gear this question as a secret to your success type question. And Governor, I don't know if I know of any other state that has relied on the National Guard as much as West Virginia has. And y'all are ranked #1 in the country. And I think that may have a lot to do with it. Military does a lot with attention to detail and efficiency, and they train so there are no weak links. I'd like to know, Governor, if you know of any other state that is leaning on the Guard as much as yours, and maybe have General Hoyer comment on the training aspect of the National Guard as making them ready for this assignment.
Paul, I don't know of any other state, and I really appreciate your kind words, but I do not know of another state that is leaning on our Guard like I have here. Paul, I truly mean this, through this. There's so many different things, but if you'll just step back and think, when we had that day of prayer, I'm a real believer in prayer, and I'm not ashamed to tell the whole universe that I'm a Christian through and through. And I know I fail the good Lord, from time to time, probably every day, but I keep trying to do better, and with lots of prayers. And He has blessed our little state, with the third oldest population of any state, and a state that has all kinds of chronic illnesses beyond belief. And here, this little teeny state has become the voice of the nation, has it not? And it really, truly has. But with that, Paul, your first question is just truly just this, is how much has the National Guard really helped? And you can't possibly even begin to have to try to put a number on it. They have been so good, so good, it is off the chart. I just can't describe to you how efficient and all the different things that have been brought to the table. Naturally, they've been led by our great general and now the great generals that we have there now. But absolutely, Paul, you've got to listen to me. In West Virginia, you've got to listen. If you have the opportunity to see a guardsman or a guard lady and you have the opportunity to buy them dinner or whatever like that, or just walk up and tell them just how great they really are and how much you appreciate them, please do so. They have absolutely carried our torch like you can't possibly carry it. In addition to that, we have had great work by all of our first responders and DHHR and all the great health, community clinics and all the county health people and everything. It could go on and on. It's just like General Hoyer just said just a second ago. The great people that are behind these numbers oftentimes, aren't highlighted or aren't in the bright lights. We're all in the bright lights, but I am telling you without any question, you have seen a real miracle happen in a state that was portrayed as the poorest, the oldest maybe, or one of the oldest, the one with the most chronic illnesses, and absolutely, we have knocked it out of the park. Almost a perfect game. The only one that can be perfect, in my opinion, is the good Lord. But this is as close to a perfect game as we could have possibly pitched. And absolutely, without any question, I'd have to say the National Guard was on the mound. I may have been there catching with the catcher's mitt, but the National Guard pitched a whale of a game here too. Thank you so much to all of them and all the great players that have made it happen. Again, I cannot possibly be more honored to be your governor, and I can't possibly be more proud of the people, all the people from our coronavirus czar, all the people through every agency, all the first responders, all the health people, all the people that have made it happen. It's been a real honor, and I'm proud of them.
All right, thank you, Paul. Next to Brendan Tierney with WSAZ.
Good morning, Brendan Tierney with WSAZ News Channel 3 here. I have two questions today. First, Governor, have you talking with State Superintendent Clayton Birch or any of the other State Board of Education members leading up to your announcement today? And do you think the State Board of Education will follow through with your goal to reopen all schools K-8 full-time? And also, I was hoping Dr. Marsh could give us a bit of the behind the scenes look on the numbers that you're looking at and why right now's the good time to have all these reopenings of bars, restaurants, increased social gathering limits compared to maybe waiting another week or two until those numbers might be even lower. Thank you.
Well, Brendan, I'll pass to Dr. Marsh in just one second, but I want you to know this, that, there's not a day that goes by that I or my people are not in contact with the state superintendent. A lot of the board members and the superintendent is in contact with the board members. We are in contact nonstop. This isn't like, hey guys, what about this idea and everything? For crying out loud, we're in contact nonstop. And from, from the standpoint, you know, Clay, on why now with the numbers, I mean, why now is because the numbers tell us this. That's why now. You know, and Clay can answer that and everything in way, way more professional detail than I can. But I am telling you without any question, you know, sure, I'll tell you what we can do. We can just wait another 6 months and we can go and we can batten down the hatches and bubble wrap us, and we'll make it probably our percentage of from the standpoint of making it somewhat safer. Yeah, sure it will. Sure it will. But Brendan, listen, you know, and I know too. You come to work every day. I see you outside a lot of times and everything. You come to work because you are living with this terrible killer. And that's what all of us have to do. We got to live with it. We got to do the very best and the smartest things we can do. And I think without any doubt we've done that. But we got to live with it. We got to live with it till we get through it. Dr. Marsh, I'm sorry.
Thank you, Brendan. Thank you, Governor. I think that the governor has really said what needs to be said. We believe that, as we have done with all other parts of this COVID pandemic response, we view this all as a rapid learning cycle. You know, nobody knows what the future holds, and we have all been surprised by different things that have happened, and we have all adjusted our thinking as we continue to learn more. We are really in a wonderful position to do these openings right now. We don't have the variant viruses that we've detected. We have really been very on top of the vaccinations, thanks to General Hoyer and Joe Peel and our GIADF and all of our responders out there. And, you know, as I said before, and as the governor said, we follow this very closely. We talk to each other constantly. And if we find that this is not in all ways or in partial ways is not what we hope it will be, which is to see things open up and continue to do so in a very responsible way, then we will make additional, you know, suggestions, and the governor will make decisions for the state. But I think that this, and the governor has asked all of us to weigh in on these decisions. I think it's the right time for West Virginia to continue to move forward and to try to get back to the privileges that we enjoy, but with lots of very intense watching and with the real need for every West Virginian to follow all of the other parts of our strategies that has helped us get here, because mask wearing and distancing and those things are equally as important for our ability to continue to open as it is vaccinate more people.
All right, thank you, Brendan. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, panel. So I really need to ask two questions today. First, for General Hoyer. So the county data regarding vaccines is showing us that, you know, our elderly population in Kanawha County, almost half of them have gotten the vaccine versus smaller communities where, you know, just not as many of them have gotten the vaccine. Can you tell me, you know, why that is the case right now, why the numbers look that way, and what the state is doing to, you know, to get those numbers kind of closer together to bridge that gap? And then I really need to ask the governor, you know, a month ago, you signed the order regarding schools that, you know, that they are allowed to open up. They should open up. You know, how is this order different? And what is the point of this order when, like you said, it's really on the Board of Education?
Dr. Marsh, go with the first part. Go ahead, sir.
Actually, Governor, I think General Hoyer might be better to address the first part, if that's okay.
Oh, that's fine.
Yes, sir. So yes, so June, so as you look at the numbers, and part of the reason we put the data up there was to be more transparent. The governor pressed us to do that and to show people that we are looking at metrics across those counties. as it relates to Kanawha County, number one, they have a significant higher concentration of nursing homes and assisted living facilities, and they have a larger population overall. In addition to that, we saw that when there were some of our hospitals, particularly in Kanawha County, that had extra doses available based on the doses they were allocated for their workforce, they took those extra doses because of our efforts to make sure we use all doses and pushed them to Kanawha County to get to that over 65 population. So I think that's part of what you see with the change in numbers. People across the state should rest assured that the task force is looking at those numbers and will continue to distribute doses based on the percentage of population over age 65 and those percentage of essential workers over 50 based on the guidance the governor has given us to get to those populations. And the good news is we're seeing a significant change in our death rates, and we're seeing a significant change in our hospitalizations.
And if you could come back to me, and I'll try to take the second part of the question, and that's just this. I sent out the order before to our Department of Ed and to our state superintendent and to our board, and basically said this, that, I was encouraging them to get back into school, and a lot of counties did a blended rate and everything and went very virtual. Well, I truly believe we ought to be in school. That's all there is to it. So with all of that, we went way, way, way beyond the call. We ran and vaccinated all the 50-year-old teachers and service personnel that wanted to be vaccinated, and thank God most all of them took the shot and everything. And then we turned right around and went back and got them all on the second dose. Now, in all of that, we were asked, that really until we got everybody with the second dose, we would basically hold up or give them the ability to go to a blended or a virtual deal and all that kind of stuff. Well, now we've got them with the second dose. And so with all of that, again, what I am urging our state board and our state superintendent to do is to put all of our kids that are grades K through 8th back in school full time. Now, the next thing right behind it is we absolutely want to try to do any and everything we can for our 9 through 12. And I love it, that our map is getting so much better, and we want to absolutely continue to be safe in every way. We've poured money into our schools to try to make them safer. We have absolutely gone far beyond the call with vaccinating our teachers and our service personnel. And without any question, we ought to be back in school. So that's what I'm doing.
All right, thank you, June. Next is Jeanette Dill with the AP.
Yeah, Vaccinate with the AP. Thanks. I'm wondering, will the state allow people with serious health complications to start getting vaccines? For instance, if you're a teacher required to return and you're under 50 with a health complication, can they expect to get a shot soon, or is there any thought behind that? And also, it appears the state got 24,000 first doses this week. Is that correct? And is that due to weather delays? Thanks.
General Hoyer, sir.
Yeah, so when the issue went out to collect the teachers over 50, there was also some notice from the State Board of Education to the county boards to also look for teachers who had been given special accommodations because of health issues. So some of those teachers were already looked at in those numbers. As it relates to the total numbers, Nate, I can get you that breakdown. But as I mentioned earlier, we are seeing some less doses this week from Operation Warp Speed. But I don't have those exact numbers in front of me right now, but I'll pass those numbers through our public affairs folks to you. But as mentioned, for example, the Walgreens doses coming in the federal pharmacy program did not arrive this week. They will come Monday, and there are some second shots that did not arrive from Moderna this week.
All right, thank you. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. Just wondering, will parents of K-8 children have the option to opt out of the mandatory in-classroom learning if they believe conditions in their children's schools are unsafe?
If that's the end of the question, Phil, absolutely. I believe, and maybe, Secretary Crouch or somebody could weigh in on this, but without any question, that they've had the right and continue to have the right, as far as parents, if they opt out and they want to go 100% virtual and everything, we're providing that, and without any question, they have the right to do that.
All right, well, thank you, Phil. Governor, I'll turn it back to you.
Well, I want to say one thing to the Fort Gay people, that are suffering through some real issues as far as water and sewer down there right now, that we do have our emergency management people that are on the way, as well as the National Guard. We have fought through some really tough conditions and getting, trees out of the roads and snow and all the issues and everything, but I know that you're seeing those people, and from the standpoint of, people running to the fire, I didn't know you had these pictures, but I'm seeing them come up there and everything. Great work by, all the people that are pulling all that off and everything. But to the people, of Fort Gay and all those counties that we declared a state of emergency in and everything, we did it just because of what we're looking at there and everything. These storms have been pretty daggum tough, and thank God, our people are on it, and they're on top of it, and they're on top of it immediately and everything. I mean, you watch the nightly news and you see people that are, again, dying, in numbers, in significant numbers and everything in our southern states because they weren't prepared, or to tell you the honest truth, they depended on a windmill, did they not? And really and truly now the power's out and it just can't work because the windmills are froze up. And they're absolutely sitting there throwing rocks at fossil fuels and say, by God, we shouldn't be using fossil fuels. I mean, that really makes a lot of sense, doesn't it? And really and truly, we I've said over and over, we embrace all the alternatives. Yeah, sure we do. We embrace all the alternatives and everything. But anybody in this country today that believes that we can do without fossil fuels today, I hate to say this because this sounds terrible, but they are so out in left field that they don't even know how to go home. Really and truly, we have got to have our fossil fuels now, and absolutely those poor people are suffering, and they're suffering big. When it really, really boils down to it, that old wonderful, nasty, and some people call it and everything, but I embrace it with love beyond belief, a ton of coal, or absolutely the wonderful work that our gas people are doing, or the wonderful work that our oil people are doing. For crying out loud, we can't do without them right now. And blowing our legs off and everything to just try to look noble, boy, that's really smart. No, I don't think that's very smart. Thank you so much. Sorry to get on that little rant about that, but watch the TV and think about those people down there that are freezing to death. Anyway, thank y'all.